Good afternoon. I'm Dr. Jeremy Adler. I'm the Tippecanoe County Health Officer. Welcome to our local COVID-19 update. This afternoon, I'm happy to be joined by County Commissioner Tracy Brown, West Lafayette Mayor John Dennis, Dr. Jim Bean from IU Arnett, and Dr. Esteban Ramirez from the Purdue Health Center. We'll begin, as we usually do, with a review of our local COVID-19 data. This first slide summarizes the 5 data points that the local health department has been following in regards to our local COVID-19 situation. The first is the number of new confirmed cases of COVID-19. Second, the percentage of COVID-19 tests that are positive. This is the percent positivity. Third, the number of COVID-19 hospitalizations, including the number of patients in intensive care and on ventilators. Fourth, the number of emergency department visits for respiratory illnesses. And fifth, the number of deaths due to COVID-19. This slide summarizes our current COVID-19 data. Thus far, we have had over 3,500 cumulative confirmed cases of COVID-19. 2,101 of those are considered to be recovered. We've had 14 deaths. That is one additional death since our last press briefing. That leaves us with just over 1,400 active cases. Of our 3,587 cumulative confirmed cases, just over 1,200 of those have occurred in the last 28 days, and 343 of them in the last 7 days. This slide shows our daily new cases of COVID-19 dating all the way back to the beginning of the pandemic in March. As you can see, the overall trend has been an increase in our daily COVID-19 cases. We had a very high number just a few weeks ago. That number has improved, but is still higher than it was earlier on in the pandemic. This slide is another way of looking at that same data. These are the average number of daily new cases by week. As you can see, the shape of this curve is similar, showing a pretty significant increase in our average daily new cases of COVID-19. The peak thus far occurred last week at 48.7 average cases per day. It's dropped a little bit thus far this week to 40.6. However, the week is not over quite yet. This slide summarizes our local testing data. We've had over 62,000 individuals tested here in Tippecanoe County. In the last 7 days, 1,883 individuals have been tested. Our percent positivity, that is the percentage of tests coming back positive for unique individuals, is 5.7%. This is pretty close to the overall percent positivity for the United States and is lower than Indiana's percent positivity. Indiana as a state here recently has percent positivity of 12.7%, 9.6% cumulative percent positivity. And this slide shows the trend in our percent positivity dating back to early May. As you can see, the number 5.7% for this week is up a little bit compared to the previous several weeks. It's not as high as we've had in the past, but it is increasing. Our goal is, as the World Health Organization states, is to keep this number at 5% or below. So we are just over the 5% mark, and we'll be watching this number, of course, very closely in the coming weeks. This next slide summarizes our peak COVID-19 hospitalizations by week here in the county. These numbers are for both of our local hospitals combined. As you can see, the number of individuals hospitalized for COVID-19 remains high this week, with 22 in the hospitals with COVID-19, 6 in intensive care units, and 3 on ventilators. The top number is the total number, the middle middle line is the intensive care, and bottom line are the ventilators. So again, this is another indicator that we're watching very closely as this rate of hospitalization is remaining high. As for ER visits for respiratory illnesses, a little bit of a decrease compared to last week, but still a fairly high number with 174 individuals visiting our ERs in the past week for respiratory illnesses. Excuse me. This week I'm adding a slide to summarize some of our local school data. This is cumulative data for all schools and school systems in Tippecanoe County. As of October 14th, so last week, we've had 94 confirmed cases in our schools. 85 of them have been in students, 8 staff members, and 1 student teacher. As a result, we've had just over 1,600 close contacts quarantined in our schools. When one considers that our local schools have a total of over 20,000 students, the fact that we've just had only 94 confirmed cases thus far is a testament to the excellent work that our schools have been doing, and also the fine work that our families and students have been doing in terms of following COVID preventive measures and wearing their masks, social distancing, and really doing all the things that have been necessary to keep this pandemic under as good a control as we can keep it. So in summary, we continue to see high case numbers here locally. Our percent positivity remains just over 5%. Again, the goal is to keep that number below 5%. Our hospital numbers have been high for the last several weeks. And of course, this impacts our hospital's capacity to care for additional individuals. It's very important that we all stay the course. This pandemic is a marathon, not a sprint. We need to wear our face coverings, practice social distancing, wash your hands, avoid crowds, and exercise caution in social gatherings, and stay home when you're sick. Remember that this virus spreads easily in crowded indoor spaces where people have prolonged contact. I know that pandemic fatigue has set in, but we can't let up now. Our community has done a good job, and let's keep it up. If we all do our part, working together, we can get through this pandemic and come out ahead of this pandemic. That's all the comments that I had for today. I'd like to turn the floor over to any questions from the media and from our Facebook Live audience. Today we're going to, because of the voting next door, we're going to limit comments to 3 minutes per person in the interest of time. Thank you.
For the mayor and for Dr. Adler also, and I guess for Dr. Ramirez too, with the football game Saturday, any special things that the health department's doing, anything, any guidance from the cities? And Mayor, if you could speak to the letter that you signed on to with the other mayors of the Big Ten cities. What are we expecting this week?
Well, first off, this week when it comes to the Purdue game, we're going to do what we've been doing so far. You know, we keep an eye on the social activities within our neighborhoods. That's always a big concern to us, as it is to our citizens. Generally speaking, we had that first blush when the semester started of a lot of behavior that needed some corrective guidance. But since that time, things have gotten, there's a lot more responsible behavior going on. And to that effect, it's sort of a relief. But insofar as the game goes, it's like anything else. There's a presumption of a significant amount of people. They're going to be doing things that generally go along with a home game. And we're working very closely with Purdue, with the university itself. Our police department and fire departments are working together, Purdue Police, Purdue Fire, and Westside Police and Fire. And probably most importantly is the messaging has been communicated. People understand that you know, celebrations because of a sports performance doesn't make the virus go away. So that they need to maintain social distancing. Just like the doc said, we just need to maintain the guidelines that we are acutely aware of. I suspect that should students choose to do something inappropriately, and I hope I'm not speaking out of term here, Doctor, but the same sort of disciplinary measures would be taken place at a sporting event and or at a gathering as it would be during the regular time of schools. The second thing about the letter, yes, I was signed on a letter. The only thing about that is I had made some corrections to it, and I spoke to some of the mayors about that. In West Lafayette and Purdue, we're actually performing better. Some of our numbers aren't close to what some of the other university communities are. Probably more importantly, when you look at the dynamic of West Lafayette and Purdue, we're unique in the sense that we are not a major metropolitan area. Obviously, we're close to one, but we're not one specifically. So that means that our results and our ability to control our population is a little bit less restrained as what theirs might be. A lot of the mayors are, and I by no means mean this to be a criticism, it's just how things work. A lot of the mayors don't have the close relationship with their university that we do here in West Lafayette at Purdue. We work closely with Purdue's medical staff, we work closely with their emergency services folks, and we work closely with their administration to make sure that we're reading off the same sheet of music. Also, with the Purdue Pledge and the understanding of the severe repercussions that could happen should they choose to violate that, that's a really strong assist when it comes to encouraging compliance to the existing regulations involving COVID. And probably the thing that we don't give enough attention to is the students want to be here. The students want to go to school. The students want to get their degrees. They also want to do what people between the ages of 18 and 23 do, but some of that's going to be restricted. And the big thing is I think in conjunction with COVID fatigue comes COVID compliance. There's a lot of behavior that's been changed over the past several months now that because of the duration of that change being implemented, a lot of that new behavior is becoming a habit. And you can see it in the grocery stores, you can see it on the streets, you can see it in the bars and restaurants. People just kind of get it now. They get how to behave and they get how to do everything within their power to prevent the transmission of the disease. And for that, that's a great big high five to everybody, because they're figuring it out, and doing that will help us keep these numbers down, as Dr. Adler was showing. But insofar as the letter goes, yes, I had some changes to it because, again, we are managing this much better than other universities. And to have crafted a blanket letter that might not be most suitable for our success was a little bit uncomfortable. The bad part about it is it got out before my corrections did, so that's shame on me, I suppose. But in West Lafayette and at Purdue, given the conditions that we're working under, given the populations, plural, that we serve, given the connectivity to other communities, we're doing pretty well. We're doing pretty well.
Sure. I'll just add that, this virus loves crowds. It loves to spread easily through crowds, particularly indoor crowds. So in situations where social distancing and face coverings are not being used, this virus really thrives. And so we all need to take that into consideration when we look at various get-togethers surrounding college football games. All of us need to be very cautious because, as the mayor alluded to, the virus doesn't really care whether it's college football or another type of gathering. It will take advantage of that and will spread very easily.
To Dr. Adler's point, this weekend's going to look very different. Our football environment's going to look very different, but we've been sending notifications as of this week on how to be able to celebrate, our football teams, how they're doing, and how do we safely do that, maintaining social distancing, keeping your masks on. We've also added some outdoor activities that they can participate in for students that are on campus. Visitors are not allowed to these particular sort of events, but the students can register for them so that we can control the amount of crowd that's there, so that this would allow a safe outdoor opportunity for these students. Also, tailgating, of course, will not be allowed at this time. All parking lots are closed and will be monitored throughout the day to make sure that that is continued to be abided by. Visitors are not permitted again at the parking lots at this time. So I want to make sure that that is clear. We do enjoy that environment, but just not during a pandemic. And so things are a little different this year, but we are excited to be able to move forward with offering some of these safer alternatives.
Just while we're still on football, Big Ten's not allowing fans, but Dr. Adler, if that changed, what would be your guidance to Purdue? Are you okay with a certain percentage of people there? President Daniels said this week he thought that might be the safest place for students to be if they could separate and have that wide open space. What's your thinking on that?
Sure. So before the Big Ten removed fans from the games, the Purdue Athletic Department did create a plan for Ross-Ade Stadium that involved reduced capacity and other measures to help reduce the transmission of COVID-19 in the stadium setting. And that plan, I did get a chance to review it, and it was a very well thought out plan, well put together. And that would be the sort of plan that would be needed if fans are allowed back into the game. So again, it would be a very different game day experience with significantly reduced capacity in the stadium and other measures put in place to keep everybody safe.
Was there a capacity, though, that you were comfortable with?
They did have a capacity, and I reviewed that in August, so I don't recall the exact capacity off the top of my head.
Question from Emily Seiberg from WBAA. This is for Dr. Bean. Do you have concerns about the impact on hospital capacity as COVID cases also surge in nearby counties? And do you have capacity concerns more generally as cases start to surge statewide and flu season begins?
Very much so. So my answer to that is we are experiencing a real pressure on our hospital capacity currently. Somewhat related to our COVID numbers. They are, as you saw earlier, they're creeping up, but general illness in the community and the care of ongoing medical concerns continues to put pressure on hospitals. So today's activity has been working to find ways to make care a bit more efficient in the hospital, transferring patients to other hospitals that have capacity, and working across our health system to share resources to meet the demand that's really growing.
You all talked about fatigue setting in. We heard it in the governor's debate again last night. What are you seeing in fatigue, and is there any thought about tightening down restrictions or loosening the restrictions that are locally made right now?
So, in terms of pandemic fatigue, and I think this is an issue not only for us locally, but across the state and around the United States, where you see numbers increasing in many areas. And, we're 7 months into this pandemic, and we all desperately want life to go back to normal. That includes all of us sitting up here, too. But the reality is that it's going to be a while before things are normal again. And so we need to adopt a mindset that we're going to have to live our lives differently for a while. And that's going to involve wearing our face coverings and social distancing, washing our hands, avoiding crowds as much as we can, really thinking about what sort of social situations we're getting into. And these are things that are not easy, especially to maintain for months on end. But these are the tools that we have until there's a vaccine and effective treatments for COVID-19. These are the tools that we have to help prevent the spread of COVID-19 and help keep everybody healthy. So I think that really we need to, all of us, stay focused and stay vigilant and fight through this. And it's not going to be easy, but I think we can do it. In terms of restrictions, as I've said before, certainly additional restrictions are always on the table, as would be loosening of restrictions. That's going to depend on what direction our data go. It's going to depend also on what direction Governor Holcomb goes with in terms of statewide restrictions and mandates. We're watching things closely, and we're always thinking about ways that we can help to keep people safe. Regardless of what restrictions are in place or are not in place, there also is a degree of personal responsibility that we all have, and we all play a role in keeping not only ourselves safe and healthy, but also our family members, our community. And so that is going to be absolutely critical, especially as we head into the winter months where we're more indoors. We have other respiratory illnesses such as influenza that are coming our way. And so it's going to be a challenge for all of us, but these are important things that we need to stay with and keep our pandemic endurance up.
Question from Facebook for Dr. Bean. The fact that Purdue has their own healthcare system, does that mean Purdue people are not coming to area ERs?
So that's not true. They have, so the answer is no. If there's somebody that needs emergency medicine care in the community, they come to one of the two local emergency departments. There is some primary care, and I'll let Dr. Ramirez detail that in more detail, that's available on Purdue's campus. But thankfully, we're not seeing, I'll share what, I'll highlight something that I referenced the other day. I'm super proud that we have a community where on a daily basis, Purdue, the health department, and both hospitals are meeting each morning to share what's going on in our organizations and have a shared situation awareness of the pandemic as it affects our community. I think this is giving us a good opportunity to act in anticipation of things versus being reactive. In that conversation, we talk about and understand what's happening across all those organizations, and it's the illness levels that Purdue is seeing are mild to moderate, as Dr. Esteban Ramirez talked about last time. And thankfully, few patients are needing hospital care.
And just to kind of talk about the services that are available, we do have the Purdue University Student Health Clinic, of course, that's available to all students. We have the Center for Healthy Living, that's for all employees and their also their dependents as well, that we have available. With regards to COVID, of course, our case managers keep in close contact with these individuals that are positive, and so once we start noticing that there are either an escalation in their symptoms, the decision is made to go ahead and recommend that they go to the ER, or we have our fire department go ahead and take them to the ER, so that way they get immediate attention as appropriate.
Are you seeing, with the schools, with the new data up there, and then just in the community, are you seeing common threads and trends for how people are transmitting? And are we in cluster stage, or is it just kind of a community stage? Can you talk to that a little bit?
Sure. Yes. In general, it's community spread. So, a lot of the things we've been talking about as people are in contact with other folks, in close contact with other folks on a more regular basis now, especially with schools being back in session, extracurricular activities, so on and so forth. Those are opportunities that this virus will take advantage of. And as the state moved to stage 5, I think that some people may have interpreted that to mean that that we're in the clear and that life can go back to the way it was before, and that's certainly not the case. So I think those things have really contributed to the community spread. We haven't had any particular clusters or particular activities that have led to a significant portion of our cases.
Not to interrupt the answers, but just follow that up. I know at Purdue, there's been talk about almost no classroom spread. Is that the same in the K through 12? I mean, are you seeing the same kind of things, or are you seeing some of the spread tracing back to classroom activities or gym or anything along those lines?
Sure. You know, in terms of classroom spread in our K through 12 schools, that's been a relatively minor component. The more significant component of spread has been sports teams, and that has been an issue at all of the schools. And I think that's just due to the nature of the prolonged close contact that's involved in sports practices and sports games. So that's been more of an issue with our local schools than classroom spread has.
And I'm sorry to pick up on that again, because most of the sports right now in schools are outside, and you're seeing that spread. Are you going to change any kind of guidance for the schools more than the IHSAA would do for basketball, wrestling, all the indoor sports that are coming here in the fall and the winter?
I think one of the main things we're looking at for the indoor sports very closely is the allowed spectator capacity. And we've started to review some of the plans with schools for their basketball seasons and whatnot. And that's one area that we're working on currently to help address that very concern.
On the topic of school sports, Dr. Adler and Dr. Ramirez, do you think there is a campus positivity threshold for Purdue University, at which point we should withdraw from sports altogether or postpone our games?
Did you want to go ahead?
Sure, I can go ahead and start. I'm not in charge of the athletic program, but I know NCAA is very particular about, they have strict guidelines on this, and I'm sure that we will follow, of course, the NCAA recommendations on that, and of course, the information passed on to the county as well, and make that decision based on that information.
Sure. Yes, and we also, look to the NCAA and Big Ten for their opinions on that. Certainly, if we were to start seeing percent positivity values, like some of the other areas in Indiana are, that would certainly raise that question of whether we should be having sporting events along with other sorts of community events too. It wouldn't just be sports. So we're watching that percent positivity very closely, and that is one of the factors that goes into those decisions.
Are we going press versus non-press, or I don't want to interrupt the press questions?
Were there any other press questions? Okay.
There might be. Okay. Thank you for what you guys have been doing. The numbers in the county look great to me. But so last time I was here, this would just be a follow-up on it. Dr. Bean and I shared a New England Journal of Medicine article that I think you all were copied on. I have copies of it here. And it's very appropriate. It's entitled Rethinking COVID-19 Test Sensitivity, a Strategy for Containment. So seeing what the Indianapolis Colts had 4 positive tests, and then they test them a second time and realized they were false positives, seeing the story with Nick Saban, who had 1 positive test and subsequently had 5 negative tests and was able to return. Is there any discussion in the county to allow that for, let's say, critical workers, starting with maybe police, firemen, healthcare workers? Now is a very busy time where people want surgery before the end of the year. A system such as is used elsewhere, and Dr. Lindsay Weaver, the medical director in the state, said is being used in nursing homes. 1 positive test, the person is totally asymptomatic. They get a 2nd and 3rd test and then be allowed to return to the critical work that they do. Is there any thought on that? I know I've talked to Dr. Wickert yesterday, who was in favor.
Dr. Bean and I had a discussion. So any thoughts on that?
Sure. So something like that, of course, would would really need to come from our State Department of Health, because that would be a very significant change from our current protocols. The CDC does have some guidance for critical infrastructure workers who have been exposed to COVID-19 and ways that they can be allowed to continue working with some serial testing involved. As far as I know, the CDC has not yet come out with any guidance about repeating testing in individuals who actually test positive, and then if that subsequent test is negative, how does that change what's done? I'm not familiar with any CDC guidance on that.
If I could add also, I'm sure it'll be resource limited as well, since we're talking about large populations to be able to retest serially like that. I know with our capacity and what we can do, retesting all our positives would potentially be a concern to what we could potentially do realistically.
Having explored this a little bit, I believe the hospitals have capacity for testing. I spoke with MedExpress on Sagamore Parkway. They use the Becton Dickinson antigen test. You pull in the parking lot, 20 minutes later they have a result for you. So I think there is some capability for that. Addressing yours, Dr. Adler, I spoke with Dr. Lindsay Weaver. I've got detailed minutes of my discussion with her about this identical question, the very question, and she thought it was a good idea to allow that in ours. So I think the process of getting it approved by her would be quick. And I'm happy to come up with a proposal. I've got a rough draft of it to submit to you guys. I can get it to you by tomorrow, and then maybe it can be brought to Dr. Weaver for her approval. Her number was she thought that asymptomatic patients being tested for contact like the students were, she thought 60% of those tests are false positives. That was the number she quoted me Thursday morning, October 8th at 10 o'clock. So should I prepare that and get it to you guys and for your perusal?
That would be fine. I would think also that sort of change would need to be approved by Dr. Box, who's the State Health Commissioner, and probably going through that channel too.
Okay, and that'd be Dr. Weaver's colleague.
Well, Dr. Box is Dr. Weaver's boss.
Okay.
Yes, she's the State Health Commissioner.
Sounds good.
Yeah.
We'll do that. Thank you.
Are there any additional questions? Nope. Okay. Well, we will see you next time. Oh, I'm sorry. Go ahead.
In terms of the capacity and the reach of our testing both on campus and in the city, how accurately would you say we're assessing the spread thus far?
Well, first we've done a large number of tests. Let me bring that slide up again. Okay. Yeah. So here in the county, over 62,000 individuals have been tested. Nearly 2,000 in the last 7 days. So there is a good test capacity. The fact that our percent positivity remains close to 5% is a good indicator that we are testing enough. When that percent positivity goes up, especially above 10%, you become worried that you're not testing enough people and you're actually missing cases. So of course, we encourage testing. That's how we figure this out. That's how we stop the spread of this, to find out who has it and who's been exposed. But I feel pretty good about our test capacity here in the county, and I think we have good testing capabilities through both of our hospitals and also through the Indiana State Department of Health testing site.
Purdue used, we had the opportunity to meet with biostatisticians and also with epidemiologists to ask what would be the right way to test our population at the university. And we were able to calculate what that percentage was, and that's how we came to that 10% number of our population. I think it has helped us to kind of keep a pulse on what's going on and help us to manage as things arise in a timely fashion.